Hi guys! Welcome to Dr. NeckNeck Explained. Itong topic natin today is about a condition wherein almost every year na ibabalita sa ating mga prominent personality, not only in the Philippines but also in the whole world. So ito, anong commonalities nila Joey Valdivino, Fernando Po Jr., Isabella Granada, and some other prominent personality? They all died of brain aneurysm. Aneurysm is abnormal ballooning or bulging of the artery of the brain. Kung sa brain man, that is a brain aneurysm. Pero pag sa abdomen, abdominal artery, or yung aorta natin, that is abdominal aortic aneurysm. So it depends kung anong artery ang may abnormal bulging. So aneurysm can happen in any part of your body. Pero ang one of the most common devastating aneurysm is actually brain aneurysm. Remember that brain aneurysm itself will not cause you to die. Kung andyan lang ang aneurysm, sometimes most of the time, you are asymptomatic. Wala kang nararamdaman. But the aneurysm is there. Nagkakaroon lang ng problem once this aneurysm is pumutok or ruptured. Ang tawag natin doon is ruptured aneurysm. It's devastating because 10% of people na nagkaroon ng ruptured aneurysm hindi na umaabot sa hospital. Alam niyo ba na pwede namang makita sa isang tao kung mayroon silang aneurysm? Pero hindi usually ginagawa at hindi usually nire-recommend ng mga doctors for some reasons. The way how to detect an aneurysm in the brain or brain aneurysm is by doing CT angiogram or MRI or MRA. In short, CT scan and MRI. So kung mayroong way na madetect kung may brain aneurysm ka, bakit hindi ginagawa? These are the reasons. About 1 to 6% of adult people have aneurysm. So ibig sabihin, less than 6 in 100 adult people have aneurysm. So hindi siya ganong kadami. So within this 1 to 6%, kukunti lang sa kanila ang nagkakaroon ng ruptured aneurysm. Actually, sa data, it's around 6 to 16 in 100,000 people will have a ruptured aneurysm. So, one reason bakit hindi ginagawa is actually only few people will have an aneurysm. That is number one. Number two, if you have this aneurysm, only few percent will rupture. So, most of the aneurysm there will not rupture. Paano na-detect na ang aneurysm ay high chance na pumutok or mag-rupture or hindi? It depends on the size of the aneurysm. Most of the time, they considered 7 millimeter, so about less than 1 centimeters, right? Parang ganito lang siya. 7 millimeter is a significant size. 7 millimeters and more is considered a large aneurysm. But 7 millimeter and below is considered as a small aneurysm. So, ang ibig lang sabihin nito, the bigger the size of aneurysm, the higher chance of rupture. Another factor to consider kung mas higher chance ang aneurysm na mag-rupture or not is actually the locations. Sa location sa brain ninyo. If the aneurysm is located in the carotid cavernous area, mas lesser ang chance na mag-rupture. Pag sa posterior circulation artery, mas higher ang chance mag-rupture. Complicated ba? So, ang ibig lang sabihin nito, depends on the location of this aneurysm sa brain mo, pwedeng mas higher ang chance na mag-rupture or not. Kung may family history ka, especially first degree family members na nagkaroon ng ruptured aneurysm, mas mataas ang chance mo na magkaroon din ng ruptured aneurysm, na pumutok yung aneurysm mo. And if mayroon kang genetic syndrome, like yung tinatawag natin Ehlers-Danlos syndrome, or yung autosomal dominant polycystic kidney disease, pwede kang magkaroon ng aneurysm na mas mataas ang chance ang pumutok or mag-rupture. And they say also physical strain or physical exertion such as straining. Kung tumatay ka, na nag-iire, na alam mo nang mayroon ka ng aneurysm, mas may chance na pumutok or mag-rupture din yan. So, pag alam na nilang mayroon kang aneurysm, usually the doctors will say, huwag kang masyadong umire, huwag kang magkaroon ng emotional stress. Isang actually part of their advice yan. But mainly, ang consideration ng higher chance of rupture is actually the size, more than 7 mm, or the locations, depends on the locations of the aneurysm. Okay? So, most of the aneurysm will not rupture kaya hindi nila regularly, routinely na ina-advise na magpa-screening. Thirdly, if you know that you have this aneurysm, right? Hindi basta-basta ang interventions. They can do surgical interventions, surgical repair, or endovascular repair. Mind you that brain aneurysm are located in a sensitive part of your body, which is your brain. So, kung ang interventions like surgery or endovascular intervention, sometimes there are risks of mortality. Yes, even though sabihin na natin less than 1% or less than 2%, still a risk of mortality. Pwede ka rin magkaroon ng morbidity or unfavorable outcomes, like can lead to a bleeding, infection during post-surgery. It can also lead to some neurological deficit kung minsan nagkakaroon ka ng numbness or sa part ng katawan mo, sa face, kung minsan nagkakaroon ka ng visual blurring of vision or double vision, depende sa part ng aneurysm na inoperahan. Okay? And of course, during interventions, pwede ka rin ma-stroke or magkaroon ka ng heart attack. So, hindi basta-basta ang magkaroon ng intervention sa mga taong may aneurysm. And lastly, dagdag ko na rin is the cost of CT scan or MRI. How much is the cost? It's about 10,000, 11,000, or 12,000. And only 6% ang mga taong, ang mga adult people ang mayroong aneurysm. At sa mga may aneurysm na to, only few of them will have the higher chance of rupture. At ang interventions itself, surgery itself, endovascular intervention itself, well, sometimes it's not as easy as you think. Of course, may mga possible risks na pwedeng mangyari during the interventions. Kaya, kahit na madaling ma-detect ang aneurysm, we do not routinely do or request for MRI or CT scan or CT angiography. Ano bang mga risk factors ng aneurysm? Okay, knowing the risk factors, at least alam nyo ang gagawin ninyo on how to reduce your chances of having aneurysm. Risk factors including family history or genetic syndrome. If your first degree family members has aneurysm, actually the more of your first degree family members have aneurysm, the higher chance na mayroon kaling aneurysm. Secondly is, kung mayroon kang mga genetic syndromes, kagaya ng sinabi ko kanina, autosomal dominant polycystic kidney disease, Ehlers-Danlos syndrome, pwede kang may chance ka na magkaroon ng aneurysm. Kung hypertensive ka, mas tumataas ang chance mong magkaroon ng aneurysm. Sa mga alcoholic na tao, lagi na lang ito, no, alcoholic na tao, tumataas ang chance mong magkaroon ng aneurysm. Sa mga cigarette smokers, mataas ang chance nilang magkaroon ng aneurysm. At saka sa mga menopausal women, tumataas ang kanilang chance na magkaroon ng aneurysm. Why? Because yung lesser estrogen sa katawan nila will lead to the lesser production of collagen sa arteries nila. Kaya nag-weaken yung wall ng arteries. Kaya tumataas ang chance ng mga menopausal woman na magkaroon ng aneurysm. So, anong gagawin mo ngayon? Iwasan ang pag-iinom, iwasan ang paninigarilyo, kontrolin ang blood pressure mo. Kailangan uminom ka lagi ng iyong maintenance kung high blood ka. At kung hindi ka pa high blood, try to prevent hypertension. That's it for now. I hope you have learned something to Dr. NeckNeck. So aneurysm is now marked as Dr. NeckNeck Explained.